I'm Dr. Sujoy Majumdar, a consultant endocrinologist from Kolkata, and I've been practicing here in Kolkata for the last 20 years. I'm also the Vice Chairman of the Royal College of Physicians Indian chapter and also an examiner of the MRCP Ireland clinicals in India. In addition, I've got several publications in the field of diabetes and endocrinology, and also I'm a faculty of the certificate course in evidence-based diabetes management. The topic that was assigned to me by the scientific committee of this annual conference of RSSDI was on cardiac autonomic neuropathy. This is a lesser highlighted topic in the world of diabetes because unfortunately, still date, there is no good treatment for that. But at the same time, this carries an adverse risk factor in patients with diabetes. Most of the patients of diabetes develop cardiac autonomic neuropathy pretty early in the course of the disease. And this can even start before the diagnosis of diabetes. There is a correlation with obesity, hypertension, and dyslipidemia. The important presenting factors of cardiac autonomic neuropathy are postural hypotension, syncopal episodes, unexplained dizziness, and things like that. So basically, if the patient presents with sort of other features of autonomic neuropathy, like urinary incontinence, hypotension, postural hypotension, dizziness, syncopal attack, these patients should be investigated for a cardiac autonomic neuropathy. This cardiac autonomic neuropathy can be investigated by several tests like the heart rate variability test, the Valsalva maneuver, the simple breathing exercise. And these tests help us quantify what exactly is wrong with the patient. And unfortunately, as I mentioned, there is no good treatment for cardiac autonomic neuropathy. The treatment essentially controls a good control of glucose. At the same time, there should be a good control of other risk factors like hypertension, dyslipidemia, and smoking. Coronary artery disease and cardiac autonomic neuropathy can go hand in hand, and together they can contribute to an increased mortality and morbidity. Particularly, there is an increased risk of silent myocardial infarctions in patients who have got this cardiac autonomic neuropathy. So the take-home message with this condition is early diagnosis and monitoring of the patient. Thank you.